And welcome back to On the Record. In studio, Dr. Jones. You know, everybody, I guess we're not just getting the information, but we're living the information right now. In majority of the public buildings that we go in, it's the hospital, you know, at the beginning people were like a little scared, you know. There's somebody sitting there, they're wearing a mask. Am I contaminated? Are they contaminated? Do I have to wash my hands? Why isn't everybody wearing masks? You know, it's like, you don't know. People are afraid to go out in public places or to touch somebody or shake their hand. So can we
So we know
some of those myths?
Right. Well, some of that there's some truth to some of those, but one of the things is, as the hospital center, we have to put in place what's called a respiratory etiquette, and respiratory etiquette means that anyone coming through our doors who presents with cough and fever will put on a mask, and we will have a designated area for them to be sitting in, and that's to separate them from the non-flu-like potential flu-like symptom patients. It's also to protect the patients who have chronic illnesses and our pregnant patients. So we have 3 areas of our waiting room that were developed. We have a active triage, meaning that we have someone that is sitting at the front desk area, which is a glassed-in enclosure, and they're asking every person coming in to the hospital if they have a fever or cough. And that is part of the protocols that we had received that came down from the Ministry of Health and the Public Health Department. That being said, that we have a very particular kind of situation because we have clients that come in from all areas with all kinds of health concerns. In the general public, people don't wear a mask because, first of all, you have to know how to put on and take off a mask. So there hasn't been shown any benefit in wearing a mask in a community setting. What people are being instructed to do is there's been a lot of information about respiratory etiquette in terms of if you cough or sneeze, you cough or sneeze into your elbow, into your shoulder. You don't cough or sneeze into your hand. If you have access to a tissue, that's ideal to cough or sneeze into a tissue. You discard it. You wash your hands. If you can't wash your hands, you use some steri gel. We know that this is transmitted through droplets. What that means, if you cough or you sneeze, little particles come out of your mouth. And we now know that they can travel up to 2 meters. So initially we thought 1 meter, and now we know that it can spread up to 2 meters. If we're in contact and I cough or sneeze, then you can pick up those particles through your respiratory system, and that's how you will become infected. Some particles will stay on surfaces, and they can stay alive on surfaces for up to 48 hours, we think. But unlikely you'll pick up an infection from touching a surface of someone who's walked by there in 48 hours. It's usually been a much closer time frame. So another recommendations for people to, like our grandmothers used to do, is to wash doorknobs, wash your handles, wash the banisters. Those are the high-touch areas. And we already had that practice at Kateri Hospital. We've already had what's called high-touch, low-touch cleaning practices, meaning anything that people touched often was going to be cleaned more frequently. And so we have that already in place. But I think communities are doing that too. Community members are doing that in their home, and that is recommended. So if you have someone who's ill at home, it's important to maintain those kinds of practices so that you're not going to inadvertently pick up the virus. But the most likely way of getting it is through personal contact. And you have to be in contact with someone, we think, for at least 30 minutes.
And are we not? Well, I don't know, but are we having people in the community stop going to events, or just to take more precautions?
Well, for the time being, there have been no recommendations from the Public Health Department of Canada or from Public Health in Quebec with respect to cancelling of activities or school closures, for example. There has been no recommendations at this time for cancelling of any event.
There are some questions that I guess some people had, is that I guess most people know by now that some of the schools outside of our community have showed positive for the H1N1, and some of the siblings that that go to our schools, should there be some concern there? Okay,
so I think people need to understand that there's no wall around Kahnawake, and we have evidence that H1N1 is within the community. I put out a public service announcement, I believe it was almost 10 days ago. And last week we had clear evidence that there was something going on at Kateri School. I think on 2 different days there was between 60 and 74 students absent. And I would suspect, and we don't have access to numbers, but I would suspect that a third of them probably had flu-like illness, a third probably had a cold, and a third were parents keeping their kids home for fear. But regardless, there was definitely some activity in the community, and that seemed to fit what we were seeing in the region as well. So between October 28th and October 30th, there was a dramatic increase in the number of calls to Info Santé, emergency room visits, and admissions to hospitals within this region. So this region is from Valleyfield all the way to Longueuil and Granby. So there's definitely some activity going on, the Montérégie. And so Kahnawake is not an isolated community, and definitely we saw the same pattern here. We saw a double of outpatient clinic visits as well for a flu-like illness. So it is here. And so the question I get often asked is, well, my child has a fever and he has a bit of a cough and a sore throat and a bit of nausea and maybe has some vomiting. Is it the flu? And so should he be tested? And we are not testing outpatients right now. We were testing initially just to kind of get a flavor to see, and we've had a few confirmed cases. And so at this point, because we do know that it is in the province, we do know that the second wave is here, and it's been well demonstrated across the province, that if you have typical flu-like symptoms, more than likely you have the flu, and more than likely it's H1N1. And it's like any other flu, the majority of people will be able to recover within a week, won't need any medication, won't need the antiviral medication, won't need to see a doctor, etc. So it's been but we are seeing it here, and it's already, the second wave has already started.
And with that, we're going to take another quick break.
Okay.
And we'll be back right after these messages.